Medical experts believe there is a higher chance of contracting flu during the rainy season. Do you know home remedies and treatments? This report introduces you to some.
Just as sure as the rainy season arrives every year, flu illnesses that go with it are almost certain. Doctors say the flu virus is easily caught during this time of the year because people usually converge, giving it an easier time to spread.
Kasi umuulan, so ang tendency ay maiipon ang tao doon sa isang lugar. At dahil sa naipon sila, no, yung lahat ng hinga-hinga nila, no, ay madaling mag-transfer ng infection.
Flu symptoms include cough, colds, joint and muscle pains, and fever. Limpin explains the flu virus is self-limiting, meaning it goes away after a certain period of time, usually after 5 to 7 days. Doctors usually prescribe medicine to treat symptoms as they appear, paracetamol for fever and mefenamic acid for joint and muscle pains. Drinking lots of liquids is also recommended. For those who want to hasten their recovery, doctors prescribe another medicine.
Yung oseltamivir, no, ito yung gamot sa ngayon na binibigay. So pwede nating ibigay yan para ma-shorten lang natin yung duration ng pagkatagal ng flu at mabilis na makarecover yung tao.
Aside from turning to Western medicine, other remedies for the flu are also available. Homeopathic remedies can also be given to those who want to turn to nature for their treatment.
It's a highly individual practice of medicine. And unlike, for example, in Western medicine, when you see a patient having fever, there's an SOP. You know, you give paracetamol every 4 hours. Here, we don't just do that.
Gonzalez says in this practice, they support the peaking of the fever to hasten the recovery process.
One mechanism of the body is to reset the thermoregulatory center in the head so that you get a higher temperature. And fever is a means of killing the medium. And it's a way of killing the viruses and the bacteria.
When the fever is still at less than 38 degrees, patients are advised to be given a hot compress and bundled in socks and a blanket. At the second phase of the fever, when it peaks at more than 38 degrees, medicines in forms of drops, pilules or pulverized pills or vials that can be injected can be given to the patient.
What we do is we support the immune system mechanisms, and we don't actually bring down the fever. We protect the organs from becoming damaged by a high-grade fever, and we actually support the fever curve.
Whatever treatment you may choose, the Department of Health says it is best to always do this after consulting with an expert.
Iwasan din natin yung self-medication. We do not advocate on that kasi nga baka naman lumalala yung condition nagsi-self-medicate pa tayo.
Prevention is still better than cure, and the DOH recommends getting a yearly flu vaccine, boosting the immune system by getting enough rest, eating nutritious food, engaging in physical activities, and avoiding crowded places during the flu season. Pia Bonalos, 9 News.